Welcome, everybody, to the next in our Spotlight series, designed to highlight real-life heroes in neurology who, through their actions, exemplify the values of the American Academy of Neurology. I'm Dr. Jim Stevens, President of the American Academy of Neurology, and today I have the honor of speaking with Dr. Aaron Berkowitz. Dr. Berkowitz is the founding director of global health at Kaiser Permanente Bernard J. Tyson School of Medicine, and he also leads the development of the school's neurology curriculum. He previously served as the global neurology program director at the Brigham's and Women's Hospital and as an associate professor of neurology at Harvard Medical School. He serves as a health and policy advisor in neurology to Partners in Health, and also serves as a special senior consultant to Doctors Without Borders. So welcome, Aaron. And if you would, tell us a little bit about your story.
Thank you so much for having me, Dr. Stevens. It's an honor to be here and appreciate the chance to tell you a little bit about some of the work I've been involved in global health and neurology. So when I was a resident, I got interested in global health and interested in working with this organization, Partners in Health, that you mentioned. And they told me the greatest need at that time for them was to do some work in Haiti. And at that time in Haiti, there was just one neurologist for the entire population of 11 million people. If you can imagine the population of New York City plus the population of Los Angeles having one neurologist for all of those people. So on the one hand, it meant that patients who needed to see a neurologist were very unlikely to have access. But on the other side, it meant their primary care doctors who they would go to for care had gone to medical school in a country where they had no access to learning from neurologists. So I was asked to go there to help their primary care doctors develop some knowledge and skills in neurology so they could care for their patients. Some of that was on site or through telemedicine or through developing policies and protocols. And that's sort of how I got started, sort of at the more general level, working in neurology and global health.
Fantastic. So tell me, because this is obviously an area of great need, but we've got a conundrum a bit in our own country where we have an undersupply of neurologists, not to the extent of Haiti or a lot of the countries that you work with. And so what do you envision is the appropriate response for those of us in the US and how we can be part of the solution for this significant issue?
Yeah, it's a great question. And I completely agree. When we talk about global health equity or global health inequities in neurology, we have to include our own country because there's a great shortage of neurologists, as I know you and the Academy are tirelessly working on. And there's a disparity in access to neurologic care compared to if you're in a city or in a very rural area. And those are similar but magnified worldwide. So I think the AAN does a wonderful job trying to inspire more students to join us in our beloved specialty of neurology. And I can think of some programs where students and residents are given the incentive to either through loan repayment or otherwise work in rural areas. But for many of us who have our established careers in our particular places and are interested in helping, I think with the expansion of telemedicine, there are so many opportunities to get involved locally and globally to support our either other neurologist colleagues who are one amongst very large populations in rural areas, or internists and family doctors and pediatricians who with little or no access to neurology, either in the rural US or in other parts of the world, to support them in the care of their neurologic patients and in their CME so they can pick up a little bit of neurology as well.
Fantastic, Aaron. Well, thank you again for sharing your inspirational story of the work that you've been doing. And your efforts tie so closely to our values, particularly the value of leadership. We guide, inspire, empower members, patients, and other stakeholders to make a positive difference in their own lives and the others who live in our neurology, and indeed, in your case, the world. And we want to contribute to the Academy mission So thank you again, Dr. Berkowitz, Aaron, for all that you do. And for everyone out there watching, until next time, stay safe and stay strong.